you know, but getting back to, if I was to specialize, I would do dermatology. And I know I'll probably get heat for this, but I love it because I joke around about it all the time. You never cure anything and you don't have emergencies.
Yeah. The
Right?
emergencies, you know?
What derm emergency is there? A hot spot?
Yeah, the people who show up at the ER for like an ear infection, we would call
Yeah,
them
but
on
they
the
don't go to
ER
the
for an emergency.
dermatologist for an ear infection.
No, I know.
you know,
Yeah,
they're
it's the
like,
when
oh,
they're going to the dermatologist, they know what they're going for, and it's usually not like urgent. So,
yeah, and
yeah,
it's a revolving door, man. Nothing ever gets. You don't cure allergies.
that's
You
so
don't.
true.
You don't.
Never
You
cure
don't.
anything. Yeah. Well,
So it's
and that's
perfect.
important. I always tell clients that whenever I always sympathize. I'll tell you right now, Dr. G, I think having a dog like an atopic dermatitis or a dog with severe allergies has to be one of the most unfortunate cards that you could draw because you're not going to cure them. And it's a lot of work and it's a lot of money keeping their allergies well managed, right? You've got to do your medicated baths. You've got to do your ear cleanings. You've probably got to keep them on Apoquel or Cytopoint, even if you do immunotherapy with the dermatologist, if you can afford that, right?
Right.
Forever. And then they're still going to get breakthrough infections. So they're still going to need they're just money pits. And then not only are they money pits, but it just takes a lot of time. Like I'm a mom of 2 little boys. And if my dog had an ear infection or a skin infection, I had to give them a medicated bath and clean and flush their ears every single day for 10 days. I would have a hard time realistically doing that. So I always level. That's the first thing I say. I say, I am sorry. This is not easy. I appreciate and acknowledge your efforts and what you're trying to do. And I'm going to tell you right now, my job is also to manage your expectations. I'm not going to fix this. We're going to treat your dog today. It might be really, really bad because we haven't been managing his things for a while. Our goal is to get him to a manageable level so that we can maintain it. But he's not going to be cured and you're not going to be able to just like not come back. I'm going to need you to come back. Because I feel like that's what happens. A lot of people go, oh, I went into the vet. I spent $700 and he got a little bit better, but then it all came right back, right? Because they're not told that it's never going to get better. Unfortunately,
Well,
I don't think we're setting clients up for success in that way sometimes. And I
right.
tell them, I say, what can you realistically do at home? Can you bathe your dog? If I were to send you home with this, can you do it? Because that's also really important to ask, right? Because like, what if they can't? Then that's how veterinarians get that bad reputation.
Oh, well, I sent you that post from today that I found that was all
Yeah.
AI generated,
Oh,
and
it was disgusting.
it was
Disgusting. That's what the
disgusting.
first thing
It's
I said.
disgusting. So stay tuned. Stay tuned. I do have a comeback, but I'm professional about it. I'm not.
Good.
I'm
I'm
not
looking
the
forward.
typical Dr. G that has so many opinions and so few filters. I was pretty good about that. And
I
so
think we need some less like lower filters at times though. We need a little bit of that.
so when you call yourself the honest vet,
Yeah.
what does that really mean to you? How did you come up with that name?
Yeah, that's a great question. So I was out of practice, maybe, I don't know, about 6 months. And I was just shocked by the amount of times that I would be in an exam room with an owner and I would make a recommendation or I would ask them something or say something and they go, oh, well, that's not what I'd read. Or I was told you shouldn't do that. Or I was told I need to do X, Y, Z. And I'd say, where are you getting that information from? That's entirely incorrect. And they'd say, oh, well, I saw it on social media or like I read it online. And I'm like, from who? Like, who is putting this information out there? Because that's so wrong. And, I got tired of seeing so many preventable illnesses and so many successful accounts on social media, like churning out garbage and just they clearly had no idea what they were talking about, but people were eating it up. And so I know that I was not going to like, those people who are diehard believers of, whether it's anti-vaccination, whether it's that raw meat based diet, I'm like, I'm not going to change their mind. Like they're too far down the rabbit hole. I don't think I can go back in and get them out. But I wanted to provide an alternative narrative for naive pet parents who might otherwise fall prey to misinformation, right? They might be seeing that. They might not be sure how they feel about it. And then maybe they'll see me and they'll be like, oh, okay. Like here's the other version, the other take, the other side. And so I wanted to start my social media account. But as we've discussed earlier, my first name is a little bit hard. It's a little bit of a mouthful. People don't necessarily know how to say it. And I didn't feel it'd be easy to remember, right? Because think about when you've got an interesting name as well, right? And when you say your name to people, they can't really like remember it because they're not entirely sure what you said, right? So then they're going to forget like what your name is. And then maybe they'll be like, so sorry, actually, can you tell me what your name is? Because I didn't understand you. So it's not a very memorable thing to have a unique first name, unfortunately. After a while, of course it is. You're like, oh, who is the person with that cool name? But like if you're trying to look somebody up on social media, it's going to be difficult if you don't know or can't spell their name. And then my last name was Simpson before I got married. I just got tired of hearing like the
That
Simpsons.
I know. Well, that went in my head first. I'm going to be complete. I'm going to be the
Yeah.
honest Dr. G. That was the first thing that would have The Simpsons.
Like,
But
yeah.
also the Civil and Simpson. I mean, you can't even say that three times fast.
No, it was a beautiful name. I mean, I love my first name. I really do. Don't get me wrong. It's unique.
But
It's
you moved higher
special.
in the. So if you go get another degree, you're going to get your diploma a little quicker now because you're no
Yeah.
longer S, your age.
Yeah. But anyway, so I didn't want to use my name for it, and I wanted to be like, well, I'm a veterinarian, but I just want to be like the doggy vet, or like I didn't like. I'm the kind of veterinarian who wanted to do all the things, see all the things, and so I knew if I was trying to get people to like not fall prey to misinformation, and there's this narrative that veterinarians are dishonest and they're in it for your money, be like, well, I'm being honest. Like this is the honest reality of veterinary medicine. Like this is the honest vet. So that's kind of where that came from, and it was one of those things where I decided on it, like, you know, in a group chat with a couple of friends and stuck with it. And I'll be honest, I've had times where I've thought about changing it. Like, does this still really fit me? Is this who I am? I've talked to some other colleagues about it, and they're like, no, don't change it. Like, it's your brand now.
No, it is your
Don't
brand.
change
It
it.
is.
It's your brand. Yeah.
You can
So,
call yourself. You could change it. Start another page called the Realistic Vet.
oh my
Just be
gosh,
like,
I would have to be like I'd have to be like you. I wouldn't be able to show my face,
right.
and then I could just say all these things without worrying about getting canceled. But
Well, the
there
thing
could,
is that you don't worry about getting canceled because that the problem is again your honesty creates conversation, which
yeah,
is so important and so
yes,
avoided because people are afraid to have a conversation in all parts of life now
yeah.
that really need to be had because they're afraid of the backlash they're going to get because of it.
100%. Yeah, that fear of the repercussion. And I think that goes back to the core of our conversation here, of that fear of the negative outcomes, right? And the fear of, well, what if I try and fail and then I get a board complaint because I didn't meet this standard of care, right? But again, it goes back to the proper documentation and setting yourself up to be protected in those cases, right? And then you still get to like fulfill your dream of doing all these things and helping as many animals as you can. Because ultimately, I think that's why we went to vet school. I know it's why I went to vet school. I wanted to help animals. I wanted to work with animals. I wanted to make their lives better. And so I
Yeah,
would think
because
that,
well, the question you got to ask though is the fear of the enemy of what we're dealing with, or is it kind of like a guardrail? And where do you draw that fine line?
yeah,
Yeah. And I think that's why a lot of these early career professionals are having a hard time.
yeah,
So, I mean, I'm going to ask you, I know who I know what do you think where do you think this fear comes from? Do you think it comes from the education, the professional academians
yeah,
who are incredible, but have never been on the front line? Do you think
yeah.
it comes from the employers, or do you think it comes from lack of mentorship?
So I definitely think it's multifactorial. I think lack of
Mm-hmm.
mentorship is a big one, but
Yeah.
not the primary piece, because I ended up not having a mentor. Unfortunately, I was supposed to. Very nice
Well,
veterinarian
you
was
did.
supposed to
You
work.
had your mom.
Well,
You
I
had your
did. But
mom.
when I went into practice, I was supposed to have like a doctor working with me in my GP clinic, and she was very nice Doctor Barker. Funny enough, which is very funny. That's her last name, Jen Barker. Really nice woman, but she had to get back surgery and had some
Yeah.
complications. It was supposed to be a straightforward back surgery, but she had some complications and she ended up not coming back. So I was a new grad doctor as the only like primary clinician in a practice. And of course we had relief doctors who would come through. But I had to draw upon my resources, because I guess my mom was a good example of like, you can do it. Was I still terrified doing all these things by myself? And even general workups, we talk about lack of mentorship, but it was like even doing like a workup for Addison's or Cushing's. I was like, oh my gosh, what if I do the wrong test, or if I don't interpret it properly, or maybe I should do this before I do that, because these are complex disorders that should go to an internal medicine specialist. And if we look at it that way, though, like, why do we have GPs who are feeling comfortable working up Addison's or working up Cushing's, which to me is honestly like, I would rather just give me the splenectomy, because like that's going to take so much less brain power than these other workups, like these long internal medicine workups. And I think it comes down to like a comfort level. Like for some reason we're more comfortable doing these things. And so lack of mentorship, maybe like not enough exposure in veterinary school, because in veterinary school we're not doing the surgeries, but we are like learning to study and research. So I think that's why maybe we're more comfortable doing these like internal med workups that again should go to a specialty clinic, but maybe they can't afford it. So we're managing that horrible like diabetes dog or whatever that just cannot get regulated, or that, you know, Addisonian case, or, you know, some kind of complex tumor or cancer situation where they can't refer, but we're doing what we can with like, you know, Stelfonta or Palladia or whatever. I feel like all of that stuff is just as complicated as some of these surgeries, but vets are scared of the surgeries. So I find that interesting, and I'm sure you probably do as well. And I part of another factor I think might play into this is I wonder if this goes deeper, like maybe to the admissions process of veterinary school. And I'm not saying that I don't want to hurt any feelings or make anybody feel bad, right? I think there's a lot of really, really awesome veterinarians out there and their selection process is good, but I think maybe they're focusing really, really hard on these academic standards. And there might be just a type of person that's more willing to like go out and get dirty and do the things and say the things and maybe ask for forgiveness later.
Did you read my dissertation proposal? Because I think you're like spitting it out word for word.
I work with some awesome veterinary technicians that
Right.
would make
Would be amazing.
Exceptional doctors. I'm not going to say her name. She doesn't like to be in my socials. She's off grid, but she's one of the greatest techs I've ever had. She asks me questions sometimes about medicine that I go, that's a really good question. Let me go look it up because I forgot. Because like, and she doesn't even have the education that I have. She's just like that insightful and like thinks about the cases that hard. And she's applied to veterinary school 3 times and she can't get in because of her GPA. Her science GPA specifically is like a little low because she got like C's in OChem or something. And I'm like, okay, but a C in like, that's not going to make, and I get it, right? You have to meet a certain academic rigor to be able to pass the NAVLE and to be able
But
to.
do you really, like, you use OChem every single, how many times have you used OChem
Not once,
since? Okay.
not a single
Exactly.
time, right? And but I mean, I get why they have this like need for a high GPA, because again, they want you to be able to think quickly and study hard and all those things before you get into vet school, because they don't want to see you fail. They don't want students that are going to fail. But I think we need to maybe go look at that and look at like the backgrounds of some of these students and maybe put a little bit more weight into some of their extracurriculars and their experience in veterinary medicine as well. I've worked with veterinarians who hate their job because they're like, I didn't know veterinary medicine was going to be like this. But I went to school for so long. I don't know what to do now. And I don't want to do like industry stuff. So I'm stuck. And I'm like, well, that's really unfortunate. You know, like I don't know what to tell you.
I mean, well, the thing is that, okay, my independent variables for my dissertation are a realistic job preview, which you had with your mom.
Yeah.
And then the next thing I have is professional identity. Like, do your values really equal what veterinary medicine really is?
Okay.
I'm looking at mentoring.
Yeah.
I'm looking at
on there.
I'm looking at emotional intelligence, which, you know, let me tell you, if you don't have emotional intelligence, you're not going to make it in this profession.
Yeah.
You're going to have the worst time there is.
Yeah.
And, you know, so with that, all that being said, you know, that's the things I'm looking at right now. And it's unbelievable for me, at least with my dissertation. Again, you know as well as I do on socials and all that, how much everyone's complaining, yet I can get 0 people to fill out this survey, which is insane. And I'm only looking at veterinarians that have been out of veterinary school from 0 to 5 years,
Mm-hmm.
because that's where you got to get them, right?
Mm-hmm.
Um, it's unbelievable to me. And I have a veterinary intelligence article that is coming out discussing how we're very good at bitching, but not very good at doing stuff.
Yeah.
Um, and it, and it, and I also released another one that was going after. I know you're Fear Free certified, but after the developer of Fear Free, when he wrote that horrible article about a month ago, did you
Dr.
read that by
Becker. I
chance?
didn't read it. I didn't read it, but I heard Dr. Molly Brinkman. She does Dr. Molly
Yeah.
Said. It's so funny. She did a like a parody of it in her
Oh, did,
stories. Yeah, she's hilarious. And so it sounded bad. It sounded like it came across in bad taste, and it was removed. And I always like to assume positive intent. So I didn't read it. I'm gonna hope that maybe he just came across badly, and because the people the same way that people took my post and thought it was bad.
yeah.
Maybe that's what happened to him. I don't know. He must be a nice guy. If he came up with Fear Free, I assume he's a nice guy.
Well, I
I
mean,
don't know him personally.
it's not a nonprofit, first off, but secondly,
Yeah.
the one thing that really gets to me is that, a lot of people say, we've done it this way for 20 years. That doesn't mean we perfected it at all. We're not
Oh no.
evolving. We're not, as a
Yeah.
profession, we're not
Yeah.
evolving. Like,
Yeah.
and that is a huge problem. And the theory I'm using for my dissertation is the attraction, selection, attrition theory, which
Okay.
basically means if you keep attracting and selecting the same type of people, you
Okay.
get this homogeneous population of
Yeah.
the same type of people.
Yeah.
Well, if we keep selecting the same type of people and we wonder why burnout's not getting better, we're wondering why emotional intelligence or emotional labor is not getting better. We're wondering why burnout, I already said burnout, but just mental health is not getting better.
Yeah.
What are we doing to switch the type of people we're bringing in? So
Yeah.
you're absolutely correct. I think we need to relook at some of those things. And
Mhm.
and I'm not saying the veterinarians that are out there now,
Yeah.
they're all like that, but the ones I've noticed that at least that I've sat down and talked to that had issues are the ones that didn't have any previous experience before they went to vet school. I even talked
Yeah.
to some veterinarians that did not even have an interview to get into vet school. They
Oh
got
wow.
in.
Yeah.
And as far as your technician goes, I would have her apply to Ross, because the veterinarians
Yeah.
I used to hire and work with out of Ross are absolutely incredible,
My
because they are the only veterinarians on the island.
yeah,
So
my
day
associate
one,
went to Ross, and she's pregnant, and she just pulled like a 10-pound spleen out of a dog who came in for limping, suspected cruciate tear, throw him on the x-ray table to check his knee. It's like, oh, also, what's in your abdomen? Like, so he still needs to get his cruciate ligament repaired. That's happening later, obviously. So she threw
right,
the ultrasound probe on him. She worked him up. The next day, he was on the table. She's pulling his 10-pound tumor out of his abdomen, 6 months, and she's not 6 months pregnant, but like 4.5 months pregnant or something. And she's awesome. And she went to Ross, and she practices like I practice, right? Where she levels with the clients, she says, like, here's the pluses and minuses of me doing this thing versus you going to the referral center. Here's the cost breakdown. Here's what you should do. Here's what we can do. And I love that. I think she's doing great. And I feel like there's this, again, we talked about this divide in the veterinary world, right? There's this judgment. There's the specialists versus the generalists. There's the people who do it all versus the ones who really want to get specific. And then there's the large animal vets and the small animal vets. And then there's also the vets who went to school in America versus like the ones who went to the island schools. For some reason, I feel like they're like frowned upon or like considered less than. And in my experience, matches yours. All the doctors that I've worked for from Ross, they all seem a bit like more willing to do things. And again, I don't know how to say this without coming across as bad. I'm not saying, but part of me is like, maybe that goes to what you're saying, where the type of student that tried to get into vet school in the States didn't get accepted, but is still going to be a really good doctor, then goes to Ross, gets into Ross, and then comes and does incredible work here, making veterinary care accessible and affordable.
Well, they've left
Yeah.
Ross already doing a couple C-sections on goats and a couple GDVs and
There you
already
go. Yeah.
fracture repairs, and
Yeah.
they've done all that, and
Yeah.
that is huge. I mean, when my wife and I were senior year at Illinois, I came in already working at a veterinarian for 5 years before I got there, but my wife's dad, it was he owned a veterinary hospital here in Southern California, so we came in and we were still in awe of how much they knew because they did when they do their it's like their fourth year here or
Yeah.
4.5 year here.
Yeah.
It's amazing what they know because they've done it.
You've
It's
seen
all
it,
that
you know?
the see one, do one, teach one idea.
Yes.
And they were
100%.
doing the teaching by that time
Yeah. That's
to all of
amazing.
us seniors. Yeah.
Yeah.
So don't put down. I mean, that is something that might be on our radar. Maybe Clemson. I don't know what Clemson's going to be doing, but
Yeah.
um, I'm really, I don't think opening all these veterinary schools is the answer, but I'm really excited that Clemson's getting one. I think Clemson's a very reputable university,
Yeah.
and I'm excited to see what's going to come out of there.
Yeah.
Maybe you can get a teaching job there. You'll
I
have to leave
thought
the coast though.
I mean, I could do like some guest appearances because we go back to this too is we haven't touched on this yet as another issue or another factor, but a client expectations or
Oh, yep.
setting
I was just about to go
expectations.
there.
Yeah,
I was just
I think
about to
that's
go there.
a huge problem. But I think there's a big fear of clients, but part of it I think goes to an inability. Not what am I trying to say? We are not always very good at communicating as veterinarians, as a profession. Communication is something that we struggle with. And so I
Correct.
think that makes us easy targets. And
Correct.
a lot of veterinarians are women who are people pleasers, and so they might not want to say the hard thing in like in the exam room, like, "Hey, if I do this, your dog could die." And you need to say the D word. You need to say your pet might die. That instead of they might not make it or it might not go very well or there could be complications, you need to say that and you need to document that because that's how you truly cover your bases and then also get your owners to understand how serious this is so that if something goes wrong they're not shocked, because I think that is part of it. And of course there are going to be some owners who are unreasonable. You might have done everything perfectly, you might have said everything perfectly, you might have set everything up perfectly, and they didn't get the outcome that they wanted or expected for whatever reason, and so they're unhappy, right? There's always going to be mean people. But I do think as a profession we're having a bit of a communication issue, and that comes to like vets on social media. Like I'm like, there's people who are poo-pooing on vets having a social media, and I'm like, no, every veterinarian should be on social media right now, and we need to, every time we see one of these silly ridiculous posts from these pet health coaches or whatever that are just spewing nonsense, we need to kind of police those because that's the only way to do it. And then we need to make sure that we're putting out credible information. And if you don't want to be one of those vets, you don't have to show your face. I don't know if you've seen Tactical Veterinarian on social media. I have no idea who that man is. He could be a woman. It could be a woman. I've assumed it was a male, but it might be a woman. I don't know. I don't know that. Well, it's
You have
definitely
an
a man.
87% chance that it's female.
Actually, no.
I'm
Yeah,
just
he's
saying.
done a few where his face is blurred, but you can still see the body. So it is a man. I was gonna say, I'm pretty sure it's a man, but I have no idea who he is as a doctor. I've been following him. We've been talking for 5 years. He's awesome. He's another kind of do it all. He was a military vet, and he posts great cases. He posts really good information, but I have no idea who he is, and I've never seen his face. And you could do it that way if you want to maintain your identity, or maybe you don't want to deal with the mental burden of it. That's fine because it is a lot and it can be exhausting, but then support your colleagues who are putting themselves out there, right? Support the colleagues that are getting like torn down by the general public for saying that you should have your dog on flea and tick preventatives, right? Like be there for your colleagues. And so we need to, like, as a whole, just encourage each other to communicate well and really focus, I think, on improving our communication, because I think that will help with some of these bad client experiences. Because if I were a client and if I always think of it with my sons, right? Because I don't know what it's like to take my pet to the vet. I've never, ever taken, well, that's a lie. When I was on maternity leave, I took my dog to the clinic for my associate to give his vaccine. So I was like, oh, it's my first time taking my pet to the vet. But realistically, I've never, as a person of the general public, taken my pet to the vet because my mom always did our veterinary care growing up. And then now I'm a vet. and I know all the things. But I take my sons to the pediatrician, right?
Mm.
And so if I were to go to the pediatrician and they were to take my son and go, okay, I'm going to take your son to the back now and do all his vaccines and cut his hair and give him a shot in the butt or, whatever. And then I'll bring him back to you. I'd be like, what? Like, where are you going? Like, so it has to be presented in a way, maybe we're like,
Yeah.
maybe I like to do everything in the exam room when I can for that reason, because I think of it that way. But there are also some pets who do better away from their owners. So maybe, you've got to present
I
it
was
that
about
way.
to say, if the dog's name is Cujo, there's a good chance that the
Yes.
dog in back will be better because, and it's like by taking the dog in back, you take away the security blanket from them.
Yes. But you also
And
have
all
to
of a sudden they're frozen.
that. Yeah, you have to communicate that. You have to say, hey, your dog's body language it seems to me like he's hiding behind you. He's very defensive of you. And personally, I'm a little worried that he might react in a fearful way and harm himself or harm one of my staff. So I would like to try to take your pet to the back, if that's okay with you, for that reason. And we'll see how he does. Because I'm not going to be able to do a good exam on your dog if he's trying to crawl under your seat the entire time. I'm going to do a much better job and you're going to get more value for your money if I'm able to put him on a lift table in the back. Because sometimes I feel like big dogs, you put them on the lift table and they're just like, whoa, I'm up high. Like, what is happening? They just like you said, they kind of freeze. And that's also not ideal. Obviously, I would love for them to be like happy and wagging their tail, but like that's better than them doing something silly and then getting a bad rap and then having to get muzzled every time, because then that becomes a snowball, right? And so it just comes to how do we communicate that need with the client to bring the pet to the back, as opposed to like, we're going to take your dog to the back now. It just comes across different. And so, I mean, I think we need to go to veterinary schools. You mentioned, you laugh about me going to Clemson. I would love to go to Clemson and talk to students about how to talk to clients and manage their expectations, like the allergy example that I gave you, right?
Oh, Dr. Hammond, we have plans. We have plans for this.
Yeah, because I think
do.
that's where we're getting a bad reputation. Again, that the client's going to go home and say, I spent $700 and nothing got better, right?
They'll broadcast it to the world.
Exactly. And then you're the bad guy. You're the bad guy. Or you step out of your comfort zone. You do this surgery for a lower cost because they couldn't refer, but you didn't explain to them. You didn't look them in the eyes and say, your pet might die. I'm not a surgeon. This wound could dehiss and we may have to euthanize. I want you to understand that's the options. You can go to the specialist or I can do it, but you know that this could happen. There's a low chance. It's very small. It's a very small chance, but it could happen. But I'll try anyway if you want me to try. And I'll tell you, I've never had a single client ever that I would feel would want to like take me to the board. Like even that client that the wound dehisced, the dog that I did the 7-day corn cob foreign body surgery on, they were just so thankful that I tried. And they thanked me and they kept thanking me. And I was like, oh, don't thank me. I couldn't save her. I tried my best, but I couldn't save her. Don't thank me. But they were like, no, thank you for trying. You gave her a chance. And her last few days, they said she seemed so much more comfortable that at least she got those last like few really good days with us. So they were just thankful that I tried.
So do you think your time on social media prepared you for handling those hard clients? Because I would think some of the feedback you get on social media could be very hateful.
That's a good question. I've never thought about that. It is, sometimes I do get a lot of very negative things said about me personally, which I find interesting. I think sometimes when people don't agree with what you're saying.
Any examples you want to give us?
No, just, I think people will personally attack someone when they don't have any basis to their argument, right? They're mad about what you're saying. They don't agree with you, but they don't have any evidence to back up their arguments. So then they look for like a person, like you must be a bad person instead. Does that make sense? Like they try to tear you down because they can't.
You don't have any compassion.
Argument. Yeah. Yep. And I mean, I kind of forgot where I was going, like this train of thought. Sorry, it just left. You said, no, yeah. No, I think in a way it does. But I think at the same time, I've just always been a strong communicator. So maybe it's hard to know. It's like, what came first, the chicken or the egg, right? Did I make my social media because I was a strong communicator? Or has my social media made me a better communicator? I'm not sure. And I hadn't really thought about it. So I think that's why I'm struggling to answer that question. But I do think it's definitely made my skin a little thicker.
Yep.
Hearing and seeing some of these things on social media, it's made me just a bit more realistic about some of the population that we're dealing with, and some of the clients
Yep.
that we're dealing with. Like, there are some clients that, again, you're not going to be able to make happy. You're not going to be able to
They're
do things
ignorant.
right. They don't know. Yeah. Ignorance is bliss, right? Everything's going well for them.
Exactly.
Their argument
Right.
is solid because they don't know what they don't know. Have you heard of the Dunning-Kruger effect?
Yes.
It's my favorite effect. It's so true, right? So the more you learn about something, the more you realize you don't know about it. And the more you realize how many gaps are in your knowledge of it, right? So the less secure you actually feel explaining it, because you realize how much you don't know. But the least you know about something, the less you know about something, the more comfortable you are talking about it, because you have a surface level understanding of this complex topic and you don't understand how much you don't even know. It's an amazing phenomenon. It really is. And we see it every day on social
Yeah,
media.
but I know, but is that part of that phenomenon laziness as well? Because like if I don't know something, I stay up to 2, 3 in the morning just trying to learn as much as I can about it.
Yeah.
But I mean, that's the one thing I don't know about the Dunning Kruger. Is it that they just don't want to go out and figure it out? Are they lazy? Do
I
they
don't know
think
if
they
I
know
would
enough?
even call it laziness, because I think it depends on your motivation, right? For me, I want to know everything I can possibly know about vaccines, for instance.
Right.
I, as a mother of two young boys, I had to decide, was I going to have my children vaccinated? I'm a veterinarian. I do vaccines all the time, but you still hear all this anti-vax stuff. And I thought, could there be any weight in this? Right? Because I'm about to do this to my boys and I just want to make sure I'm making this. So I sat down and I did my own research, as much as I hate to say that, but I also have a background in medicine. So me doing my own research is a bit different than your average Joe, because at least I can kind of really understand what I'm reading, and I can also critically evaluate data, right? Not all data is good data. I was trained, we had a class in part of our pharmacology class, actually, was how to identify good data and critically evaluate data. That was priceless. That was probably one of the best parts of my veterinary school education. And our pharmacology clinician, she even had us argue for the other side of things sometimes, just to like practice. Like, it was so good, like look at all the evidence, like go against your biases, like identify your own biases. We learned all of that. It was great. I loved that class because I use that all the time now. And I had to make this decision about whether or not to vaccinate my own boys. Ultimately, I did vaccinate them. Obviously, I mean, I'm very medically, pro-vaccine and medically forward and everything. But yeah, I mean, these people on social media, they're not so invested in learning about this, right? They don't really even understand kind of how vaccines and the immune system work. So they wouldn't really even be able to go down this rabbit hole, because they'd have to start back in immunology. To really understand it, you'd have to go back to immunology 101, right? And nobody wants to sit through. I hated immunology, right? I don't want to go back and sit through my immunology lectures until 2 in the morning. My motivation for that is very low. My motivation for learning about vaccines is very high. And for some of them, they might jump straight to that. So they miss that crucial foundation knowledge to understand immunology. So I don't think it's necessarily laziness. I think it's more of a motivational issue, like what motivates each person uniquely. And I think just the general public needs to kind of remember, like, their humility, right? Like, you need to remember that you don't have this foundation of knowledge. Like, I couldn't go build a bridge. I'm not an engineer. I have no idea how to do that. Do I want to stay up until 2 in the morning learning to build a bridge? Absolutely not.
You would
Absolutely.
have to stay up to many mornings till 2 in the morning to learn how to build a
And
bridge.
you would
I
also
just
have to stay up until many, many mornings to learn about vaccines, right? But for some reason, the general public feels that they can just understand this incredibly complex topic after watching a few videos on social media, or staying up until 2 in the morning one time, watching very biased and selected videos on YouTube. So it's a dangerous time, really, to be practicing medicine. And again, I don't think it's laziness at all. I think it's a motivation problem, and a motivation problem for multiple factors, like whether or not it's a personal interest or a relevance, or whether or not they just think they need to know. But I like to know everything I can possibly know about medicine or things that apply to my life. So when I started seeing some of these exotic pets with Dr. Berger, I thought, okay, if I'm going to do this, I'm going to do it to the best that I possibly can. And so I would stay up until 2 a.m. doing exotic CE. I went on Vin. Vin has some excellent exotic CEs for beginner. They've got your rabbit 101. It's like 3 hours of like bunny stuff. And then they've got their anesthesia 101 for, it's like another 3 hours for bunnies. And there you go. I did that. I did the ferrets one. I did all this stuff because I'm like, well, if I'm going to see these things, I want to make sure I'm not, I'm going to do the best that I can for these patients. And again, so much of it though, I only needed those short blocks of lectures because I had already built this huge foundation of knowledge in veterinary school and clinical practice on which I could apply it. Right. Because you couldn't
Yeah.
go to YouTube or whatever. You couldn't go to Vin as a layman, as a person outside of medicine. You couldn't go to Vin and watch one of those 3-hour rabbit videos and then be ready to do rabbit medicine. Right. You have to have all of that other education first.
Well, why go watch a 3-hour video when you get a 30-second clip on TikTok that tells you everything?
I know. From somebody with zero scientific background.
Exactly.
And it's hard. I recently learned, Dr. G, that the average reading level in America is 3rd grade.
Well, if you do content, you know that all content needs to be done at the 5th grade level.
Is it the 5th grade? Okay, I did not know that. Well, I didn't know that, so I'll have to update all my stuff. Like maybe that's why I've some of my stuff. I'm like, why didn't that do better? It's because I use some words like, but that's disheartening to me? Somebody who's trying to combat misinformation, because it's so much easier to believe and understand the person who's simplifying topics so much so that they're like discrediting us because our topics and our explanations are too complex for them to understand. So we're the ones who are wrong, right? Because we're like, no, that's not how this works. Blah, 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 blah. All these medical terms that they can't understand, right?
Well, it's an art to learn how to explain medicine to a client in a way they understand.
It is.
And what I always tell, the people I would be mentoring, I'd always say, okay, imagine that's your mom sitting there. How would you explain what's going on to your mom?
That's a
or
great
to
way
your
to say it.
brother or your uncle? Or, that's how you have to do, or your best
Your
friend.
3rd grader, your 8-year-old.
Exactly.
Yeah.
Just so, and I don't want to say dumb it down because you don't really dumb down medicine, but you got to put it in words that they understand.
100%.
So I want to put you on
100%.
the hot seat. You ready for these?
Okay. Yeah.
Pet obesity, is it neglect, true or false?
Oh, that's a rude question for me. It depends. If you know your pet is obese and you do nothing about it, I would say that's neglectful. If you're ignorant to the fact that your pet is overweight, then that's not neglectful. Can I do both? Can I have both?
Oh my gosh. Okay, you're not going to pull aside. Okay, that's fine. Veterinary medicine is moving in the wrong direction, true or false?
Oh, these are not nice questions. I think.
Well, you said you're honest. I just taken you there.
I worry about the future of veterinary medicine if we continue to move into a realm where it is so specialized that pets will ultimately lose access to care and affordable vet care.
Yeah, I'm worried about the cost of care. 1000%. That is a huge concern I have.
Yes.
But we need another big recession, and I hate to say recession because that R word kills a lot of people as far as their businesses go. But they're going all these big corporate groups that are charging astronomical prices are going to learn very quickly that if you make veterinary medicine a luxury item, that is the first thing to go.
Yeah.
Right? People are still going to go get gas in their car. They're still going to go buy clothes, yet there won't be brand name clothes. They'll probably, go to Walmart, a homage to your Walmart, to buy their clothes. They'll get groceries, but they will wait till that dog's pain threshold is an 8 out of 10 before they bring it in instead of a 3 out of 10.
Yeah, they'll skip the parasite prevention for those bugs they can't see, right? Because they can't see it.
Exactly.
Yeah.
I can't see that.
Yeah.
Oh, and just remember, the one thing a lot of people don't explain to their pet owners is that one flea bites a dog 100 times to get a full blood meal. Think about that.
Yeah.
Imagine getting 100 mosquito bites. How would you feel?
Yeah.
Are vet schools really producing this imposter syndrome instead of producing confident doctors?
I would actually say yes to this question. I'm going to confidently say yes because when I graduated veterinary school, I actually felt a little bit less than because I didn't specialize. And I think a part of that is that there's a lot of pressure in veterinary school to specialize because everyone who's teaching you, everyone around you did specialize. They chose to specialize. So the fact that you're not specializing is almost frowned upon. Maybe it's in an unconscious way, but I did. And I remember telling people, I was like, well, I don't want to specialize. And they're like, oh. And we had one student I was on a rotation with in small animal surgery where we went around at the beginning of the, the rotation. We all, kind of introduced ourselves to our clinicians and our residents. And we said, our name, where we were from, and what we wanted to do. And she proudly said, she goes, I want to do GP. And everyone was like, oh, you just want to do GP? Like dog and cat GP? And she was like, yes, I want to do GP. And it was weird because the people who want to do large animal didn't get that reaction. It was like large animal GP is okay, but small animal GP was not. It was kind of like, oh, that's all you want to do, So when I
Can I one up
graduated,
you on that? Can I
go
one
ahead.
up you? How about the fact that, oh no, I don't want to do an internship. I'm going to go right into private practice.
Yeah. It was like, well, why not? Why don't you? And I was like, well, I don't want to work as a full-time doctor for like 60 hours a week plus weekends and get paid 30 grand or something like that. I was like, I got student loans. I got bills to pay.
Yeah.
Yeah. And I was definitely judged for that decision. I was personal friends said stuff to me like, oh, you don't want to go be, they said that you don't want to go be a Banfield vet. I was like, no, I don't want to be a Banfield vet. Like, I just want to go practice. Like, like in that, we need those vets. We need those vets who are doing the wellness care. And that's what I was trying to clarify earlier too. Like, it's okay if you want to do wellness because we need wellness care is important, right? Keeping the pet population in general healthy will keep more pets healthy by that herd immunity. But yeah, so imposter syndrome I do think is real, right? It's like, oh, the specialist should do this and the specialist should do that. And they're not really setting the students up to be a great generalist because of that.
Okay, for years we've had the same talking points, right? More mentorship, more support, but there isn't any change. What
Mm.
is it going to actually take to disrupt that cycle?
I wish I knew, and I wish I could. I'd love to put something into action to do it because I do think we need to do mentorship and empower these students to do more as generalists. So I guess if I had to come up with something, and something I've actually been thinking about is we need maybe to get some more generalists teaching in veterinary schools so that veterinary schools can see, okay, this is what a confident and capable general practitioner can do. And then maybe even at the CE level, right? When we go to CE conferences, it's mostly specialist speaking, almost exclusively. It's rare that you see just a GP giving a lecture on how to do something, even though a lot of GPs are incredibly adaptable and versatile because they've had to be. And they have so many awesome tips and tricks they could teach us on, like, again, how to do a splenectomy at 10 a.m. and then do a TPLO at 11 and then, do a Cushing's workup at noon. It doesn't have to be that, specialized, but just
Right.
how to see so much in a day and how to manage that. Right.
Yeah, and well, I'm very excited to say I am running my first CE, Ready Vet Go, as asked if I would run a CE.
Very
So,
proud.
and it's going to be very simple. It's going to be called diarrhea,
I
and
love
it's
it.
going to be run by me,
Runny
and we're going to
diarrhea.
break it exactly, and we're going to break it down very simply: puppies, kittens, adult dogs and cats, and then seniors.
Yeah.
I have lectures I'm going to do. They're 20 minutes long, but I'm going to break it down and basically keep it simple. And like, like I understand there's amazing tests that you can run, but not every case needs all those amazing tests.
Yeah.
And what if you run the run and you're running the wrong test?
Yeah.
Then you got to break that to the client. Like,
Yeah.
oh, we shouldn't, yeah, and I bring this back because I bring this story up all the time. When I was a senior in veterinary school, a dog came in for a nuclear scan of the liver because they thought it had a shunt.
Hmm.
And then they did an ultrasound, and then they did an endoscope. And then I remember asking, has anyone run a fecal on this dog? I don't see it anywhere. The freaking dog had
Whipworms or something.
whipworm.
Yeah. There's,
After, I, I mean, come on.
yeah.
I mean, Those are simple things, and even the specialists get it wrong. So
Yes.
don't think the
Yeah.
specialists and the academians are the end all be all, because they
Yeah.
make mistakes too. So
100%. 100%. Yeah. But
okay,
I do think
so
that would be the solution, is putting more capable generalists in front of veterinary students and even young career veterinarians, so that they can see, like, hey, these guys did it. They're doing it and they're successful.
right, two more. I got two more of these hot seats, and then I
Okay.
got a couple questions to finish it up, and we'll be
Okay.
good. Um, if you had the power to redesign a veterinary school, what was the first thing you would let go, and what's the first thing you would bring in? I know
Ooh.
I bring in would be GPs. You already answered that.
Yeah, I kind of already answered that. So I'd
And
probably bring in more
you
general
can't say
practitioners.
immunology. You can't say immunology or virology. Okay,
Can I
you
let
can't
go?
get rid of
Can I
that.
let go of parasitology? Because, like, that that's a lecture that I do feel like is kind of we've got all this. We don't need to identify ticks anymore to see what diseases are coming, because we can just run a tick PCR panel and then give the dog next card and then. But
Right.
what would I let go? That's such a tough question. What would I let go? I guess I think vet schools. It's hard because when you're a fourth year vet student, you think, oh my gosh, here I go. I'm going to get to do the things, see the things, touch the things, feel the things, but you don't, right? There's
You're
the
fourth. You're
clinician.
fourth on the depth chart.
Yep.
Yeah,
There's
you're
a
fourth
few
on the depth chart.
residents, there's some interns, and then there's you. And you're lucky if you actually get to, like, watch a surgery. And I felt very lucky. I actually got to scrub in on a hemilaminectomy. Try saying that after you've been talking for 90 minutes. And hemilaminectomy. And I was standing right there, and it was awesome. And I was like, oh, guess how many times we got to do that, though? Like, once. I got that once. It was because it was like a 2 a.m. surgery. It was like, we did it like in the middle of the night on this back dog, right? And I did it with the third year surgery resident. He was awesome. He was so nice. And but that was his choice to let us. Not all residents have to do that or are willing to do that, right? They don't want you standing there. They're worried you're going to mess them up. He was like 1 month away from finishing his third year. He was going off to private practice. He was basically boarded neurologist at this point. He was like, and he was so nice. And I think he felt bad for us. And he was like, here, you want to see something cool? Come stand here. Watch me do this. And I was scrubbed up. I was gowned up. I wasn't allowed to touch anything, but I was right there, right?
Don't breathe on it. Don't. You can't
Yeah.
breathe.
And you know what's
Yeah.
crazy is, like, of my full year, we do 52 weeks, we do a full year. That was like one of the only times I really got to be, like, up close
Yep.
doing things. Of course, like, you get to feel your cranial drawer sign, and you get to do some bandages on ortho, and you get to, place a couple of catheters in ER, and maybe if you're lucky, you'll get to do CPR if ER is really busy or something, and do some
Right.
stabilization. But in terms of, like, hands-on stuff we got to do in vet school, it was quite low, unless you were on an externship and away from the hospital, and then only if you were doing, like, one where they had that kind of medicine being practiced. So I do think they should make some efforts to get students more hands-on stuff. But I guess that's more of what, like, more stuff I would bring on, right? So it's like, what would I get rid of? It's hard to say, right?
Right.
We
I
had
yeah,
to go ahead.
yeah. I don't know. I know. No,
Yeah,
I'm
I don't
thinking
know what
about
I'd
what
get
I.
rid of. I can think of a lot of things I would want to bring in and add in, but it's like,
But
what
you
would I
have to
get
get
rid
rid
of?
of something.
Yeah.
Yeah.
I don't know.
I,
Well, you know what I would
I
say is, for, like, all the kids who really want to do large animal, like, really, 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 really want to do large animal, it's like, are you going to make them do small? But then I think about me, right? I was thinking I want to do large animal, and I ended up doing small. So I kind of understand why you need that too.
yes.
So it's
Yeah.
it's it's tough. I don't know. I don't know if I can answer that.
I kind of get rid of tracking. I
Oh
definitely would
yeah,
get rid of it. I would train people to be veterinarians again.
yeah.
But that's just me, because you know how much, I equine internal medicine taught me. I actually was supposed to do an equine internal medicine internship and then
Okay.
residency. But then I decided, hey, let me do 14 weeks of clinics in the equine ward during foaling season.
Mm,
That changed my whole concept of equine medicine.
yeah.
I'm fascinated by equine internal medicine. I thought the professors I had in that were amazing, because they brought real life experiences in when they taught, which
Yeah.
was awesome. And it also taught you how, equine medicine's a lot about insurance, and a lot about, what the horse really truly means. Um,
Yeah.
but the other, I was also very lucky though, because having those 5 years at a veterinary clinic before I went to veterinary school, those two doctors I worked for, those two guys were my second and third dad, and they took me under their wing and they taught me everything.
That's
So
awesome.
I was very lucky. So I knew if you go into veterinary school with the hours, like your technician, if she, I hope she gets into vet school,
Hmm.
but she'll go in there and she'll be able to read through the lines like, okay, that's a bunch of crap. I really don't ever need to know that. Oh, that's important. I really need to know that,
Yeah.
because
Yeah.
you can really place it. Like I would get rid, I would make immunology and virology one course.
Yeah. You
Sorry.
absolutely could.
Yeah, you absolutely could. And I would get rid of poultry medicine because I didn't need to learn about ducks.
Yeah.
And I actually spent a month learning about ducks. And
Yeah.
I'm like, I love ducks. I think ducks are cool. I would love to own a. Don't get me wrong. I would have my own pet duck. I want a pet turkey. I want all those things. But I don't know if I need to do that much in the poultry. But that was
Yeah.
just me. But I wouldn't change a single thing about veterinary school as long as, because I was a C equals DVM type of person. Um,
I wish I
I
had
made sure I went.
that.
See, if I was like, I was
It
at
didn't
Illinois,
matter.
so I went to the football games, I went to the basketball games, I went to everything that Illinois had to offer,
That's
because I'm
awesome.
like, this is so cool. Like Texas A&M, I tell you, I know where I'd be every other Saturday during the fall.
Oh, I
There's
was
no doubt
there.
where
No,
I would
yeah,
be.
it's hard to
Yeah,
say no to
okay.
that. It
Yeah,
can't.
okay.
It's like
Okay.
a mock
Exactly.
name.
Yes. That
You hear
you got
that?
the 12th fan. It's
The
amazing.
Yeah, you hear the call, the Aggie whoop, and we all come running like
Yeah,
locusts.
exactly.
It was
Yes,
fun.
exactly. Uh, So now, last two questions I have for you are just, I don't know if they're personal, but I just want to know, because you're doing a phenomenal job with your online presence and your
Thank you.
platform.
Thank you.
You're doing an excellent job as well, being a veterinarian, and you're also a mom and a wife at the same time. How are you balancing all that?
I mean, I don't, right? There are times where it's not a perfect balance, right? Sometimes it's this way, sometimes it's this way. Um, I often feel like maybe I'm letting one part of it go at a time to like do more over here. So I always tell people that I'm not balancing it. It's social media is a highlight reel. You know, you guys see, if I look easy, I look confident up there. You don't see the imposter syndrome. You don't see the girl who used to throw up before surgery days, right? You just see, I've had students who come through and they're like shocked when I tell them that. They're like, "Oh my gosh, you know." I was like, "Yes, me," because like I might look good and confident and capable now, but the only way to get better at it is to keep doing it, right? And it's the same kind of with life. It's like I'm not really balancing it all. I'm just doing it because I recognize that I can. Like I survived vet school, right? So like working and having kids, it's it's just another thing you have to do. It's another part of life. It's another phase of life. Right now, I think I might be the busiest I'll ever be with the young kids and the job and the side hustle on social media. But one day I know that my kids will be older and I'll be just devastated that I'm not picking up Legos at 10 p.m. after the boys have gone to bed or getting up at
You mean
5
stepping
a.m.
on Legos?
Yeah,
You mean stepping on Legos when you're
yeah,
half asleep?
right. Well, that's why I have to pick them up before I go to bed because I've done that, right? We don't want to do that again. So I mean, but it's a beautiful ride, and if everyone's different, some people really value creating, a really good balance in life, and some people need that. And I don't know that I'm that kind of person. I think that I get bored very easily, and I really, really like challenge. And I find that for me, I don't like to be too comfortable for too long. I'm like a shark. Like if I stop swimming, I'll die. So I need to kind of keep going. And then of course I'm like, I get tired and I need to take a break. I need to take a step back and then I come back again. And I've taken several breaks from social media when it just gets to be too much. I've disappeared for like 3 months at a time. And I've always felt so good about it. I'm like, oh, I'm so glad I stepped back from that for a little while because the scales were tipping too far. So I needed to kind of jump off to let these come back up. And then now that I've gotten these back up to stable, I'll come back here again. So it's not always this perfect balance that it might seem. It's a lot of struggle and a lot of give and take. But I do find everything that I'm doing to be so rewarding. I wouldn't give up any of it. I wouldn't give up my career. I love my job and I love what I do. I would never give up my family. Becoming a mom is one of the greatest things I've ever done. And again, it's not for everybody, and that's okay. But for me, it was a must. And it's been so fantastic. And it's also, I think, made me a better doctor, right? Because I can say, if this were my child's pediatrician, how would I want them to talk to me? And it all comes together. And then on social media, it's social media is my therapy sometimes for this job, right? I can go on social media and I can rant and rave about the animal I lost to the flea infestation, right? Because that's my therapy. That's my outlet for some of the frustrations that I have for seeing animals die from preventable illnesses in 2025. That's how I process that. And I need that to keep me sane. And it's fun at times, right? So there's times where I can be very dramatic and I can share the hard stuff. And there's times where I'm just having a laugh. And I feel like that in itself is part of a balance.
Well, if you can't laugh at yourself, then you
Yeah.
you're going to have a hard struggle in life in
Yeah.
general,
Yeah.
because
You've
life
got to
is a
be able to
grind.
laugh.
Life's a
You can't
grind.
take
I
yourself
mean,
too seriously.
yeah, and like I said, I being a mom, that's unbelievably difficult. Even if you have that progressive marriage and the husband does 50%, it's always still the moms that make those doctor's appointments, schedule. Even though the dad will be driving carpool, mom schedules the carpool.
So true.
You're you
That is
need to,
so true.
and then you're picking up the Legos at 10, even though he
Yeah.
probably picked them up at 9, and you're making sure they're all picked up.
He's
It's just
probably like cleaning the kitchen while I'm cleaning the living room. My husband's fantastic and he's a wonderful father.
right,
And I'm very,
right,
very
exactly.
blessed. And that's probably part of why I can do all this is I also have a lot of support.
Yeah,
Um, yeah.
absolutely. Well, I would love to have your mom on here one time and interview her next.
She'd be
Let's
fun.
let's find
She'd
out
probably
about
be
the
more
true
fun than
Dr.
I am.
Hammond.
Well, she's also, 65 now, so her filter is completely deteriorated. She just does not care anymore. She'll tell you like it is. She can't get canceled. No one can cancel her. She's done. So she'd be a wild ride. She could tell you
Oh,
about the things she's
I
done
would
and
love to have
seen.
him.
Yeah.
Oh
Yeah.
my gosh, that would be amazing.
Oh yeah.
Okay,
I can look that up for
last
you.
question. Oh yeah, you would? Oh, that would be
Oh, yeah.
awesome.
Yeah. She'll get more views than I will though, and I'll be a little hurt.
Oh my gosh, so the competition
Yeah, you'll
starts.
also
That's
have to have
amazing.
your beep button ready because she has a pretty potty mouth. So you'll have to like bleep.
I do too. No, I do too. I'm being very, very
You
good right
are.
now, but
You're being so
I
good.
I, I yeah, the F bomb is a medical term, in case anyone was wondering. Uh, if the, and if this conversation sparks one crucial conversation tomorrow in the clinic, what do you hope it's about?
I think the same topic we've been kind of coming back to again is that I want generalists to believe in themselves and to know how capable they are to do more than just the basic care for dogs and cats. I want them to recognize that they went to veterinary school and they've built this incredible foundation of knowledge and that it translates across species, it translates into different aspects of the field, and that you are so capable as a doctor and you don't have to be afraid of messing up as long as you acknowledge to the client that you can. So I would just want to remind my colleagues, I want to spark the conversation of remembering what you can do and being willing to try when needed.
And make sure you mark it down in the chart.
Mark it down,
That's it.
document everything
Document.
thoroughly.
Yes,
And
verily.
fortunately, like I said, I have not yet had an experience where it's been a problem. I've had threats, and this was just general practice. This was before, and it was nothing that went anywhere because they were really empty threats from just some unsatisfied patients back in Austin when I first started practicing. And that was hard. Just hearing from clients that they dislike you and the way that you practice, that's hard. It's hard getting negative feedback, but I'm thankful
Well,
to never have been.
you were fresh out of school. Your
Yeah.
mentor wasn't there.
Yeah.
What did you expect?
Yeah.
What did you expect?
Yeah. And I think
I
part of
mean,
it too is that maybe I didn't communicate with them properly, right? Like if I had been better about setting expectations and having and saying the hard things in the exam room that I'm able to say now, I might not have ended up in those situations.
Yeah. I agree 1000% with you on that. So, but let me tell you, Dr. Hammond, it's been an absolute pleasure. We could probably go on for another 3 hours because you might be a different sex than me and be a lot younger than me. But I mean, the thing is, there's you and I do have one thing in common though, which is we are cheerleaders for this profession, and
Yeah,
we really
I love
want to
this
give
profession.
back. Yeah, this profession's amazing. It's done as much for your life as it has for mine, right? And
Mhm.
I just hope I want all veterinarians to feel the joy that we have. There are hard
Absolutely.
days. I'm not saying there aren't hard days and where you question yourself, but it should just be a day, not your
Absolutely.
entirety. So, well, it was great talking to you. I will be talking to you again soon, I'm sure.
I hope so.
And yeah, I'm not scared now. No, no. And by the way, I did homage to you. Do you see?
I did notice that. I did notice that.
Okay, I did that. I did that for you.
Thank
And
you. I'm jealous though.
yeah,
Next
just
time you have to ship one to me so we can have one
oh,
together.
oh, dude, you could go to the Piggly Wiggly and go pick one up.
You've got the Harris Teeter, the Publix next door.
Harris Teeter. Oh my gosh, I miss Harris Teeter so much. I forgot about Harris Teeter. That's like the Trader Joe of the Carolinas.
Hmm.
It really is. It is. So we'll to everyone listening out there, we'll catch you next time here on our Irreplaceable Truths. Talk to you soon.